to welcome you all to today's speaker series event. Thanks for coming. We're so excited to have you, and we're really happy to have our guest speaker today. Just going to give, for those of you who attend these, you'll have seen some of these before, but I just want to introduce the series to those of you who might be new to Hopkins or new to the speaker series. This is, I think, the fifth in a series of 7 or 8, if we find one more speaker, sessions where we are actually inviting people who work in practice to speak to us about practice careers. But the one thing that they all have in common is that they all have PhDs. So they are talking about what kinds of careers you can have outside of academia if you have a PhD, which is, I know that some of you want to go into academia, some of you don't. And so we want to make sure that we're seeding the world of practice with people who are well prepared as well. And Peter is a good example of that. So let's see. So here's the purpose of this series is to provide students with exposure to professionals with PhDs who work in epi and evaluation practice careers, so that students can make more informed choices about non-academic careers. And the audience that you have before you, Peter, and is postdoctoral fellows, PhD students, master's students, and frankly, anybody who saw our announcement who really wants to know about practice careers. So it's a series that's designed for PhD students, but anybody can come. And Emily Gurley, who's over here, let me say hi. Emily and I lead this series with substantial support from the surveillance outbreak response team, and with a tiny bit of funding from the vice provost for the snacks that you will enjoy afterwards, and additional funding from the International Health Department, just a tiny bit. And we have some admin support here from some of the people listed on the slide. And some of these people are part of the surveillance outbreak response team, and they're also here in the audience. Thank you, SORT members, for your help with this. Oh, and I'm Melissa Marks, by the way, one of those people listed. Before we introduce today's speaker, I want to tell you that we have 2 more scheduled speaker series sessions, and one has a speaker already, and we're still actively searching for the best speaker we can find for the last session in December. So if anyone at the end of this talk has any ideas, just let somebody in SORT, if you know who they are, or Emily and me know. But on to today. Today's speaker is Peter Hansen, who was a student here at Hopkins in the International Health Department, Health Systems, right?
Right.
In the Health Systems program. He is Senior Monitoring and Evaluation Specialist, and one of the places I saw you listed as in charge of results. That's a very big task for the World Bank, and focused on the GFF, the Global Financing Facility for Women, Children, and Adolescents. Peter leads the GFF's results work stream. And previously, he co-led the results for development's health portfolio and served as director of the Health Systems Strengthening Accelerator. He also worked at the Global Fund, where I saw him last time, to fight AIDS, tuberculosis, and malaria, where he led a department responsible for accelerating the introduction and scale up of innovations and ensuring scientific and technical quality, of investments of more than $4 billion per year in over 100 countries. Basically, he made sure that the data coming in were useful for program planning. How's that? That's a little better than that. Right. He also worked at Gavi, the Vaccine Alliance, where he led M&E and investments in strengthening country data systems and capacity. As I said, he's a graduate of Johns Hopkins School of Public Health, and you worked in Afghanistan, and it was with David Peters?
Yes.
Yes, with David Peters, who's our just recently departed chair of international health. So with all of that, I will first have maybe I have an agenda here. Yes, Dr. Hansen will speak about his path, his background, his current work, and then we'll open it up for questions. I've got some questions queued up. Sort always has some good ideas, but I'm going to open it up to the group first. And I mean, anything you want to ask him, I don't know what he thinks about this, but anything you want to ask him is fair game. And this is a small environment, so we have a little bit of a more formal setting than I usually like, but please feel free to ask questions to get advice about a career like his. And please stay for the food. We always have way too much food at the end. And if you stay till the very end, you might be able to take some home. We'll be in the gallery afterwards. So without further ado, I'm going to introduce Dr. Hansen and appreciate your coming and talking with us today. Right ahead. You can sit there. Okay.
You don't think you
We haven't.
that's even better. Oh.
Let me just make sure. There's just one button.
Oh, okay. I think very well. There's one button I can press. Is that working now? Okay, great. Well, hi. So I haven't prepared any presentation, no speech, no talking points. I really was viewing this as an opportunity to exchange organically, to hear from each other, to learn from each other. As Melissa noted, I did come from Hopkins, did my PhD here. I mean, I won't repeat the bio, but it was an awesome experience. I loved it. Keep the Hopkins identity strong, draw upon the experience, everything from the formal course instruction to all the informal interaction, the people you get to know, the ideas you exchange on what I was challenged to do, work I did with Hopkins, also in the field at that time. To me is just a core part, I think, not only of what I try to bring as a professional, but even who I am as a person. So I don't know, what did we just open it up here? See if anyone has any questions.
About sort of how you got where you are.
Sure. Okay. Yeah, absolutely. So yeah, I mean, I guess I would start with the fact that when I was in high school, I had a notion that going into medicine might be useful. Like sort of the idea of being a healer, helping society in some way was kind of resonated with me, even if I wasn't very focused, even if I, didn't care for pre-med courses very much. It's kind of the thinking ahead to the other side of that and working in ways that could improve people's health, I think was something that interested me a lot. I really didn't know much of anything about public health. My father was in clinical medicine. He was a clinical oncologist. He did a lot of research as well. So I think the research side and the clinical side I was familiar with, but the public health practice side of it, I had no clue. I really didn't have much exposure, or at least not much exposure that I was really conscious of and attentive to. And I was in, I guess I graduated from college without a clear plan. I wanted to go live and work abroad for a while, and did that. I had a notion that I would come back after some international experiences, come back, finish up the last of the pre-med prereqs that I'd kind of put off. Just I didn't enjoy it very much. I mean, it didn't really stimulate me intellectually in ways that I was looking for. I had been a comparative religion major, an international studies major, and always thought that, well, I'll come back to the pre-med stuff. It's sort of something to just kind of suck up and take care of to get to the other side of that. And when I went back to the same university, this is University of Washington in Seattle, where I did my undergrad, when I went back to finish up the prereqs, I met a really great professor of medical geography, and he became a mentor there. And I, began to ask him a lot of questions and talk to him. And I thought, medical geography, I've never even heard of that, but it was fascinating. It's absolutely interesting. I took, because of the sequencing of the remaining pre-med courses I needed, like I couldn't do the section of biochemistry I needed to do for another term or two because of how the courses were organized. So I built upon the medical geography thing. I did intro to international health. I took intro to epi, took some other classes like that, and absolutely loved it. but still didn't really let go of the med school thing because I thought, well, okay, now I understand that public health is out there, and I was interested in being a public health practitioner, but I thought I would be I thought I could do that. My assumption at the time was I could do that most effectively by going to medical school. And it was this medical geographer mentor, University of Washington, who really disabused me of that notion. And he said, look, if intellectual curiosity drives you to that, go for it, knock yourself out. But if it doesn't, if intellectual curiosity leads you elsewhere, you can get where you want to go on the other side. You can work in a practice role where you can contribute to making people, making communities, making societies healthier. I thought that was great news. Talk about sort of hearing something that reaffirms, what you want to believe. So I said, yeah, forget the med school thing. That's not for me. It's for other people. That's great. That's maybe even right for many of you. Congratulations. That's great. Yeah. And so I went back internationally. I was working at this point in China, working for a small health NGO. And then from there, I applied to grad schools. Decided to go straight following this new line of thinking, decided to go straight for the best public health programs I could find. Health systems, it was a totally new concept to me. I had decided first, actually, Hopkins is the best. It's what little I know of the field, I understand. It's the oldest school of public health in the world, still the biggest, if I'm not mistaken. And I just thought, if I'm going to go, if I'm going to take this seriously, why not go and learn from the best and have access to what a big institution like Hopkins and JHSPH can offer me. And then within that, I had to figure out, basically every track within IH interested me, and I had to do my whole process of considering I have to apply to only one, but this one is interesting and that one is interesting. And I think, in fact, the way they were organized and labeled at that time is maybe a little bit different than it is now. But I think it's probably a similar kind of consideration. I did land eventually on health systems. In fact, the first time I even really remember encountering that term was when I was weighing which track in IH that I wanted to apply for. So I read a little bit about it, and the sort of systems aspect really resonated. I think it kind of fit my view of the world and my interests a lot, but not as a narrow lane, right? As sort of a, you got to choose one track, right? And that did sound broad. That gave me a chance to connect into epi, to stats, quantitative sciences, qualitative sciences, social behavior change. And all of that. I did apply to other schools as well. But for me, it was a no-brainer when I got the Hopkins acceptance. Thought, yeah, let's just go for the best. And I think no looking back from there. Had a phenomenal experience, amazing professors, amazing classmates. I was planning, because I had been quite China focused before coming to Hopkins. I thought I had, in fact, even lined up a PhD topic in South China. And I had even done my, I can't, to be honest, I can't even remember the terminology of the different steps. No, it wasn't a practicum, but it was one of the early steps that I'm just blanking out on the term that you need to complete. I think it was around the, obviously not my thesis, my proposal. What do we call it when you put forward a proposal?
Oral.
Yeah, oral exams. Yeah, oral exams around where you defend your proposal, what you want it. Thank you. See, yeah, been out of the institution too long now, I guess. That ring a bell for anyone? Yeah. So I even kind of did that on my proposal to work in China. David Peters was my advisor, and I had other people lined up. And the specific project I was going to do my PhD on and the institution I was going to work with fell through. Really more for political reasons on the side of the institution. They couldn't enter into that kind of partnership at the time, even though they'd been very keen. And that was right when David Peters and Gilbert Burnham and Ampersy Edward and others won a big RFP process from the World Bank to do third-party monitoring evaluation in Afghanistan. And I thought at that time, with my plans, my initial plan for the doctoral work without following through, actually saw that as an opportunity to revisit how much geographic specialization I wanted to have. And I thought, well, I'd been really focused on working in China for a while. China also was just developing so fast on its own. I thought, I'm here at Hopkins. I should branch out. Like I should work in some other geographies and on some other issues. And I might still go back to China if I want, but I might decide to do other things. And so I approached David and I said, well, yeah, you remember how I told you this thing was falling apart? I want to drop that. And, maybe I can work on Afghanistan instead. Maybe there's some role in that big new activity where I could contribute and do my doctoral work. He said, are you sure? That was a pretty good proposal and you had everything lined up. That looked good. And I said, yeah, I'm sure. Why not? So he said, yeah, welcome on board. Let's make it happen. So I went out. I first went out there to spend a summer, and that was the summer of 2004. It was really interesting because that work started out as basically third-party monitoring and evaluation of the World Bank project in a subset of provinces in the country, but the money was channeled through the Ministry of Public Health. And that first summer, when we were getting this off the ground, the Ministry of Public Health said, we don't want a third-party thanks for this third-party monitoring evaluation in a subset of provinces. Well, guess what? We don't want a third-party evaluation, and we don't want to work in a subset of provinces. We want a monitoring evaluation system for the country. They pulled out the org chart for the Ministry of Public Health, and they said, do you see this nice box? It says M&E department, and there's an HMIS department, and here's a disease surveillance department. Well, we don't have any of that. That only exists on paper, and we want you all through this project to help build all of that. Like, surely you have some framework, you have probably some tools and resources. Maybe you got some know-how, you can help us develop these things. And don't just focus on the World Bank stuff, right? We're not trying to, carve Afghanistan up like a melon. This is about the whole country. So that was really great, right? Because that opened a door for a very different kind of approach. That first summer, I was able to travel all over the country, though I wasn't supposed to, and the rules got stricter. Once I was in Afghanistan, I kind of slipped off. It was there was a different country director there at the time, and I was meant to be leading work in one region. So we sort of developed our frameworks and our tools and worked with the ministry to line things up. And then we split out to the regions of Afghanistan, 5 different regions, and 5 different people from Hopkins, one to each region, supporting the training there. And we were doing a training of training at that level, and people were going to go out to every province. And, we had a few rules about movement and what we were and weren't allowed to do, but I was able to stretch them a little bit. And I was able to, after the training, I made the case. I didn't even make the case. I informed David and the country director that I would have to accompany the survey teams out in the Northeast region because, well, there were issues and it required close engagement and stuff like that. So basically able to spend the whole summer traveling around. We moved village to village. We went in and we'd go into the village. We would introduce ourselves, explain what our purpose was. Almost every village welcomed us very warmly. They would bring us tea. If we had to spend the night, they would figure out whose home we were going to speak in. The men would go to either one home, the women to another, or it would be one compound, but there'd be different parts and all of that kind of stuff. And I was able to go to some very remote areas, very fascinating communities. In addition to the health facility assessment side, we were also doing linked household surveys. So, you get the supply side data and the demand side data and bring it all together. It was really, really amazing. And then after that, David invited me to be the country director. And so he said, why don't you come be the country director? And you can finish your doctoral work on the project here and all of that. So I got married and met my spouse here at Hopkins as well. She was also in the health systems program. We got married and basically took our honeymoon going back to Afghanistan. So she was finishing up her PhD there. And I began working as the country director. it was very busy because that was really a full-time job and a half. We were embedded within the ministry. We really pushed to the pushed is not the right word. We extended as much as we could. I think a service orientation. It sounds like a funny term, but hopefully you know what I mean. We didn't view ourselves there in a narrow research role, and like we all do research in one form or another, right? And that's part of the training that we all come here for at Hopkins. But I do think in the field there's also a fine line, right? And I think it's sure. I mean, it's great to dedicate yourself purely just to the research side. Many people do that, do great work, help address knowledge gaps, which helps people for sure. But I think in Afghanistan, it was more of a hybrid model or a mixed model, because we were doing research, and there, without doubt, we were doing evaluation, and there was rigor to the evaluation. There was rigor to the research. We had research studies nested within the evaluations, and it was all really quite creative and dynamic. But we also were there to really help, going back to that original request from the ministry. We were very purposeful and attentive to supporting the ministry to really develop their own capacities, right? To make sure that M&E box on paper didn't exist only on paper, but that there really was a function inside the ministry, and that it was led by the country, aligned with their needs, and so forth. And so there was a lot of that as well. And, they just, in some ways, I think meant that there was maybe more to do than otherwise would have been the case, but it was very, very rewarding, very exhilarating. Maybe I'll just add one anecdote, maybe to speak to the trade-off between research and, say, capacity strengthening or leadership strengthening. Is when we were up for a contract renewal, the program had grown quite a lot. There were more grants and contracts and projects that were coming in, and we tried to make sure it was coherent, like it all fit an overarching framework. It obviously all had to work its way through the institution here as well and make sense in Afghanistan. And when we were up for contract renewal at one time, the university, I don't know if it was new language in the agreement or if it was just more attention than it had given before to the right that Hopkins has to publish scientific articles based on the data that were being collected. And I was really at the crunch point on that one, because on the one hand, I was dealing with senior faculty members and lawyers here at Hopkins around how important that language was. On the other hand, I was negotiating with the Ministry of Public Health, for whom that was not a priority, and for whom that was, quite frankly, viewed as a bit extractive and a bit at best, sort of secondary to their main objective. And I remember one particular meeting going to the Ministry of Public Health and really doing my best to explain why that was so important why that was really worthwhile, that it wasn't just extractive, it wasn't just kind of a narrow, self-interested thing coming from Hopkins, but something really very fundamental and important to the way that knowledge is produced and shared. And I was not getting far with my arguments. And the senior official, he was a deputy minister of public health at one point in this time, he slammed his fist on the table and he said, "Damn it, I don't care. I'm trying to save the lives of women and children here. And you're just talking to me about your right to the data and publication." And 99% of the time you're working with me, today you're working against me. Like, that's just not my priority, and there are just other things to do. And it's pretty humbling and pretty interesting to see those different perspectives. I feel I've been rattling on for a while, so maybe I can.
Maybe you could talk about sort of how you chose your job after the finished.
Yeah.
Sort of how, I guess, you've already talked about sort of why did you decide to talk to us about your first job and how you landed on that, and what in particular you have done with jobs that you've had, because I think for a lot of people who aren't like invested in M&E,
Yeah.
what does that really mean? And then also, what does a practitioner do? Global fund. So,
Great.
tiny
Yeah.
little question.
Please. Yeah.
Give us the
So they actually signed, the government of Afghanistan signed on Hopkins terms in the end. But yeah. And I think my sense is they just got annoyed, right? To the point where they gave up. And I think it was coupled with trusts they had in those of us that they knew, right? Because we really, like, we were with them during the day, we were with them during the evening. I mean, we were, they would invite us over for holidays. One year at Christmas, we hosted, these same colleagues over at our compound, when someone's mother passed away or when someone had a baby born, we would go and pay the respect to the family. So it was very relational, to use one term. It was a very significant investment, I would say, in relationships and in trust. And so I think a lot of trust and goodwill had been built up. And I think, I don't know for sure the counterfactual, but maybe in the absence of that investment, they might have just said, we don't want you anymore. And actually, even in later years, I don't know that same investment was necessarily happening, at least a few years down the road. And I think some of those connections maybe didn't continue in the same way. I also think that the Ministry of Public Health saw the value of the work, right? We'd been working at it for a few years. And I think we'd very significantly built up the capacity of the ministry. So they really had demand for the support and they didn't want to lose that. I think if it had been a new project or without the same level of trust that we would still be helping them in that way, I don't know that they would have signed. And it never became an issue in the end, right? I mean, every single publication, we always had co-authors from the Ministry of Public Health or from other institutions. We never were extractive in practice. So I think in that way also, the what could have been a legal issue on paper never played out in practice. Yes, please. Yeah. Yeah, I think it's hard because, it's what comes to mind is sort of the anecdote about it taking time to build trust, but you could lose it in a day or an hour or 10 minutes or whatever, right? So I don't know that there's a shortcut to that. I mean, to me, I'm trying to think of a way to say it that doesn't sound corny or inauthentic or something, but I think at the end of the day, a lot of it does come back to basic principles, right? Like, do you honor other people's trust? Do you respect them? Do you make an effort to understand their perspective and meet them where they are? I think especially in context of, I mean, some of those things are just general, right? About human nature, more so than maybe being about our work specifically. But I also think if I consider how that applies to our work, uh, I mean, I guess I have a theory which in my mind, it almost sounds corny to even voice it out loud, but I do very fundamentally believe that if you embody certain principles within your work, that will naturally, like without trying too hard to build trust, if you do respect other people and extend your trust to other people and make an effort to meet them where they are, especially if you're supporting a ministry of health or an NGO or something, or a community. If you are truly and authentically committed to helping understand them and help them solve their own challenges in ways that work for them, then I think that will, generally speaking, I think you would like, that's how trust is created. And that's where then I think conditions are created where people will give each other the benefit of the doubt and support each other and that sort of thing. I mean, I guess I can't help, maybe if I can add one more reflection to it. I mean, to me, does also speak to the decolonization agenda within our field. I think there is a historical backdrop to much of our work where so much of it is coming from a place of good intent, like true, real intent to help other countries, other communities, other people to be healthier, right, or to resolve other development challenges they have. That's a lot of the history of our field, but I think we have to recognize also that that's not the full history of our field, and that there are lots of examples of research studies or projects, initiatives, development activities that that don't come with that kind of positive intent, that are more extractive in nature, or that do aim to control other people or get something from them. So, you know, I think that hasn't gone away. And I think many of the countries and communities that we support still have that as a relevant part of their history and context. I think that's helpful to keep in mind also.
Questions, we can go back post PhD.
Yeah, yeah, with pleasure. So, so I finished my PhD there in Afghanistan, and I stayed on. I was became whatever, I can't even remember the categories, to be honest. But yeah, I was was that, a scientist or an associate? One of the two. Maybe I was a scientist. Yeah, I was given a non-tenure track faculty position to continue the work post degree, and that was great. I mean, I absolutely loved the work. It's you know, Afghanistan is a very intense environment. There were a lot of security issues were getting worse over that time period as well. So whereas in the early days, I could travel a lot, you know, sleep on someone's floor in a village, you know, spend 2 days crossing a mountain with a survey team, that kind of thing. You know, by say 2008, that was no longer the case. We had many. Also, I have to say, I was also feeling it as a when I became the country director. Part of my responsibility was for security, and we had a lot of students and faculty come. You know, a lot of people wound up doing their PhDs there, or you know, wound up working there for a summer and you know, working on a paper and then going back and having a good experience, that kind of thing. And it was a challenging part of my terms of reference, because it's hard, right? I mean, it's like security manage. I personally think managing other people's security is not that fun, right? Because it's a lot about rules and procedure and risk. You know, how do you what is your risk framework? What is your risk appetite? What kind of risks can the institution accept? How do you individually deal with that? It's a lot of stress and pressure. And to me, it's just not the fun part of the work at all. And there were instances where, for example, we had some students come who wanted to go out to some parties at night in Kabul, and I had to say no. I had to lay down the law and say, I'm sorry, you do not have permission to go out to this party. You know, we have a curfew this evening, and you can't. And I've told the driver not to go anywhere. And they said, no, my friend's car can come pick us up. I said, no, I'm sorry, you can't. And so, you know, that was it's something that has to be done. It's not that fun. And I mean, also, to be frank, I don't know that our institution is necessarily set up to provide support for that as well, right? Like that's not a core function of JHSPH, right? So you're a little bit exposed and on your own and trying to interpret the rules. And even when you do query something, you're generally speaking, you're going to get the most risk averse perspective possible. It'll often be a liability first perspective, right? So the institution, they don't care if people have that's what's going to sound harsh. I was going to say the institution doesn't care if people have a good experience there. Of course, the institution does. But what I mean to say is, if you're making decisions in context of weighing, you know, is it more important for people to go out and enjoy an evening on the town, or is it more important to be safe and minimize the risks of a kidnapping or a bombing or a shooting or whatever? Well, you know where the institution is going to come down, right? I mean, almost every institution, including our own, comes down on the latter. So that wasn't really a response to the question, I think, but it was I was trying to add a little bit of color to say that I was reaching a point, and my spouse was as well, where we had an absolutely fantastic experience in Afghanistan, and just thought it was time to look ahead to the next chapter. So I just begun to look around and think about what was next when I saw a job advertised at Gavi. Basically, Gavi, so this was late 2008. Gavi was about 8 years old. It had never had an M&E function. I don't know if people know Gavi very well, but so Gavi is a partnership, and the what people often refer to as Gavi is the secretariat, or the secretariat supports a broader partnership, and most of a lot of the technical work, including on data, on evaluation, was being done by the partners of the alliance, not by the secretariat. But Gavi had reached a point where they had decided that even though WHO and UNICEF, along with other partners, but they were the main two, were doing a lot on data, right? They were regularly estimating immunization coverage and supporting vaccine preventable disease surveillance and fulfilling other kinds of functions very well. There was not much of an evaluation perspective there, and there were a lot of other things that needed to be assessed and measured and tracked over time. Especially as Gavi became interested in not focusing on immunization narrowly, but through more of a systems approach, right, with the new health system strengthening support window and other kinds of support windows as well. So I saw that, applied for that role. I was lucky enough to be selected, and that job was basically to create an M&E function within Gavi. So that was another really fun challenge. I've not had a job before or since that was as rewarding as the one in Afghanistan. So I wouldn't be surprised even if when I retire, which will be many years from now, that I can imagine I may still look back and really think of that as probably the most interesting professional experience I've had. But Gavi was really interesting also, and in particular, I liked the entrepreneurial aspects of creating building up a function where one didn't exist previously. So a lot of degrees of freedom associated with that, a lot of opportunity. So I worked there for about 8 years, and I did really enjoy that a lot. Developed frameworks and approaches. We set up a modeling consortium. We put in place a number of routine monitoring activities. We had a very interesting portfolio of evaluation activities as well. We got a notion that help changing the paradigm of how agencies were doing evaluations would be useful, with a lot of emphasis on switching from kind of backward-looking retrospective approaches to prospective approaches to evaluation. And one reason I'm chuckling there a little bit is where Melissa and I first got to know each other was at the Global Fund, where the Global Fund was learning from the Gavi experience with prospective evaluations, but then took it in a very different direction, which I think that was probably not the greatest initiative in the world coming from the Global Fund. But in any case, the Gavi work was absolutely wonderful. After about 8 years, I thought, well, it's been a great run. I'd like to mix it up and do something different. We actually were, back now that I think about it, I applied for a faculty position here, and was planning on, if I was lucky enough to be selected here, it's a tenure track role, we were going to move back and live here, and I was going to rejoin Hopkins in that capacity if I was going to be selected. I was not at that point yet. And just actually right around the time where I was invited to join the shortlist for that role, I was offered a job at the Global Fund, and Global Fund to fight AIDS, TB, and malaria, really just down the street from Gavi in Geneva. And it's funny because I remember when I was in Afghanistan and flying to Geneva to interview for the Gavi job, for some reason, I don't really know why, I felt motivated during the interview to proactively say, I was only going to work there for 3 years, right? I'm interested in working for 3 years, and then I'm going to leave. We're going back to the field. I'm really much more interested in country-focused work, but I think this won't be so bad for 3 years, kind of thing. And then right around the 3-year mark, our first child was born, and then the next 3 year, at the second 3-year mark, our second child was born, and then we were getting ready to leave a couple of years after that, and that's when this opportunity came up with the Global Fund. I thought, yeah, maybe Hopkins can wait. I didn't know obviously if I was gonna be selected anyway. So I took the job at the Global Fund and worked there for about 3 years. I will say, actually, in that something evolved a little bit between the time I left Gavi and when I left the Global Fund. When I was still at Gavi, I felt close enough to research, even though I was not in a research practice role, I still felt close enough to the practice of evaluation and research to be credible as a candidate at Hopkins. Like I thought, well, I don't know, I'm more of a practice candidate than an academic candidate, but if that's what the department wants, I might get lucky enough to be selected. But I thought it was at least reasonable to throw my hat in the ring. But actually, after 3 more years of being away, I didn't really have that confidence anymore. And I felt, I make it sound like a crisis of confidence. I don't mean it like that. I just meant I did, I think, view myself a little bit, my self-perception had evolved a little bit, where I thought my work is now one step even further removed, especially because I think at the Global Fund, I had part of the evaluation portfolio with me in the monitoring portfolio, not really the part that Melissa was working on. I think otherwise we could have done more with that activity. It was a really weird structure. I'll spare you the details on that. But I had a lot of other responsibilities. I had a lot of managerial responsibilities. I was responsible for the partnership strategies, the TA approach, all this stuff about technical, those nice things you read off, the technical assurance and quality of the investments and stuff like that. That was part of my role, which I felt took me away. Like with Gavi, I was working with data every single day. Basically, at the Global Fund, I was working with data a lot, but not necessarily every day. And so I just thought, I'm more of a practice person now than I am, a future professor, for example. So I don't know if that's a relevant or interesting reflection or not. That's not to say that the work stopped becoming interesting. I think the content of the work has been really, really interesting. The Global Fund was actually a great experience. It's a crazy environment, but I definitely enjoyed it, and I feel I learned a lot about our field. It's huge. The financing is huge. The influence is huge. Does a lot of good things. There are also tons of distortions and other problems, and kind of seeing that in action, I think, was interesting. Maybe I'll pause there again and see if anyone wants to pick up on anything. Please. Um, yeah, it's a little bit hard to say. I think the other roles were very rewarding, and I wouldn't say I ever felt my hands were tied. Like even at the Global Fund, where I was like really doing a lot of management and strategic work. There definitely was part of me that enjoyed that. For me, the biggest difference was um, meaningful depth at country level, plus all the relationship stuff that I was mentioning before. I think in a cross-cutting role, for me, there's part of the brain that's stimulated by that, right? Because like every country is interesting, right? So if you like right now in the GFF, we're mostly supporting 36 countries. Those 36 countries are so interesting, right? There's not a boring country among them. And what you learn in some countries, you could transfer to others. So that cross-cutting aspect, I think, is really interesting. But at the end of the day, for me, it's less rewarding. It has been less rewarding than my my China experience was also very rewarding, but those two experiences where I was working more deeply in one context, I felt at the end of the day provided a type of satisfaction and psychological reward that I think is harder to get in a cross-cutting role.
You explain what you are doing day to day in each of the roles and how they're different?
And actually, before you do that, can we like pause on that question. Can you explain what GFF is
Oh, yeah, sure.
and World Bank and what you do? And then we'll come back to more granularly what you kind of do on a daily basis.
Yeah, sounds good. Yeah, I talked so much about the earlier stuff. I didn't mention GFF. So GFF is the global financing facility for women, children, and adolescents. It's a partnership whose mandate is to support improvements in the health and well-being of women, children, and adolescents, hosted at the World Bank. So we're part of the World Bank. We work within bank systems. We're subject to bank policies and that kind of thing. And but at the same time, there's a pretty freewheeling strategy and partnership. So a lot of work within the bank is very rigid and bureaucratic, right? The big bank operations, the kind of $500 million concessional loan or IDA grant comes with a lot of machinery, right? A lot of financial management, a lot of reporting requirements, a lot of rules and regulations. The GFF, I think we do a lot of the more creative and interesting stuff. Data and results measurement are a core part of our strategy. A lot of the work that the other parts of the bank do on data and M&E are more of the bean counting variety, right? You set up a project with certain results that are intended to be achieved, and then there's, there are agreed indicators and reporting processes and regular missions and reports that are sent, and you have to track in a fairly linear way against those. I think within the GFF, we've had a lot more room to get creative. So I think that aspect, in any M&E type job, I do think that sort of the fundamentals of, defining, your theory of change and your results framework and your indicators and how you map the data requirements and how you track them in a standardized way over time. Like those fundamentals don't go away, but I think there's a difference between that being everything, that being all you do, as opposed to, that plus a lot of other things. So we've been able to, I think, really experiment and do interesting work within the GFF on data. We have a great partnership with Hopkins here called MAGE, Monitoring and Action for Gender and Equity. Rosemary Morgan is the PI for that work. Anju Malhotra, I think she's a senior scientist maybe here in the department. She is seconded to the GFF. We set this up with the Gates Foundation. It's really working to strengthen the way that we integrate gender and equity within all of our data and measurement related activities. Fantastic. Brilliant work, wonderful project. Absolutely love it. Also addressing a huge gap in our field. Another fantastic initiative that we have, which Angelica works on, is something we call FASTER, Frequent Assessment and Surveillance Tools for Resilience. And it has a history that goes back to COVID. During COVID, we were supporting something called the Service Delivery Learning Program, where we had country leaders come together in these virtual fora, and it was a community of practice, basically. They were exchanging perspectives around their challenges in identifying issues with service delivery and informing improvements. When COVID hit, the big issue that they were talking about in all of their meetings was what is happening with the delivery of basic health services in context of COVID, right? With concern about the direct and of course also the indirect effects of COVID, right? Policies that limit mobility, people's perceptions or fears of the virus, wide range of other issues that could occur, which could lead to disruptions in delivery of essential services. So they said to the GFF, can you help us identify, put in place an approach that can help us identify gaps and shortfalls in service delivery? So we put in place a program which at the time we called Monitoring of Essential Health Services. Had three main components at that time: monthly analysis of HMIS data, existing routine facility-based reporting system data, usually DHIS2 in most countries, but depending on what platform countries have, and then high-frequency phone surveys of both health facilities and households. And through these three approaches, we were able to support countries to identify shortfalls or other variations in service delivery levels relative to what would be expected in the absence of COVID. I think there have been a number of papers published on this work. It's been really interesting. As we began to move away from everything as all about COVID all the time, we adapted this work program to really be more oriented toward routine system strengthening, supporting countries to strengthen the overall resilience and performance of their systems. And we added a few components as well. This is what Angelica has been contributing to while she continues with her work here. And by the way, we have a lot. There are a lot of Hopkins alums. In fact, almost the whole team is like Hopkins alums for that work program. But I think we've been able to take forward a really creative and dynamic program of work, which is, I think, been met with great demand at country level. We're trying to get creative and figure out ways we can scale that demand up even further. To me, this is this to me falls in the category of rapid cycle analytics and data use approaches, right? Where one of the big shifts here is trying to move away from your 5-year DHS or mix, right? A big household survey, which may take many years to plan and conduct, and even these surveys will have a reference period that you may be looking at, live births or all pregnancies that occur in a time period that goes up to 3 years, or in some cases even 5 years prior to the date of the survey. So if you're a minister of health, a director of policy and planning, you're trying to make decisions about women, children, and adolescents based on data that may be 8 years old or 10 years old, right? And a lot of other PHC measurement activities, also like the PHC PI, the PHC Performance Initiative, supported by the Gates Foundation and many other organizations, has, they created these vital signs profiles and all these nice frameworks. If you look in detail at the data, a lot of the data they put before countries literally are 8 or 9 or 10 years old. And, I don't think there's a single decision maker out there who feels that is really adequate for meeting their needs. So we're trying to change the paradigm and better align the time cycles for generating, analyzing, and using data with real-world decision-making needs. We've also added a qualitative component where we now do targeted implementation research to address key questions identified. There's an evaluation component that we've been able to develop out. And to me, this is a really important initiative which contributes to changing practices within our field. So I think back to the original question, within the broader bank with more of the bean counting M&E, we wouldn't have had space to do work like that. But I think within the GFF, because we're really, I think, coming from a broader partnership perspective and a different strategy, we have, I think, a lot more space to innovate and experiment in ways like that. It's awesome.
But maybe you went through, I also do monitoring and evaluation. So you said model and the results framework, and for those of us who work in this, that's like, no-brainer. But not everybody works in that space. So I wonder if there's more you can talk about as far as what you do what you have done in your various roles on a daily basis.
Yeah. Yeah, what was I doing on a Tuesday? And yeah, absolutely. So maybe starting with Afghanistan, but I'll try to keep it brief because I know I talked about it a lot already. In Afghanistan, I think the work was both technical and strategic and operational. And I mean, like I was saying earlier, especially with the country director kind of role, there's a lot of leadership and management that goes with that as well. So I had to do all of those things, right? And I might, like pick a random Tuesday, in the morning, I might have meetings at the Ministry of Public Health. Then I might have a block of 2-3 hours to work on some analysis, right? Well, was doing quite a lot of analysis myself that time, also working with, other analysts, both within the ministry and at the Hopkins team in Afghanistan to, basically contribute to, the design of studies and analyses, the methods, the approaches, even sometimes the coding and the do file and the interpretation of the outputs and stuff like that. And then maybe after that, a couple of hours trying to worry about security or the budgets or the financial reporting. So it's really, it's a mixed bag for sure. And I do think one of the big, I do feel one of the major decision points in any person's career in this field is whether you really want to concentrate your time more on technical matters, or whether you want a combination of technical matters plus maybe some leadership and management responsibilities, because the day-to-day experience is so different, right? I mean, it literally is the difference between, running the numbers yourself and thinking about new methods you can apply, as opposed to doing something more administrative in nature, or, providing support and coaching to someone else who may do that work themselves. Maybe just one small anecdote. On my first day on the job at Gavi, I went in and they showed me, okay, here's your desk and here's your computer and here's what you have on the computer. You got your Microsoft Office package and you got this thing and that thing. And they finished a list and there was no Stata. And so I said, okay, well, what about Stata? And they said, what? I said, Stata, it's a statistical analysis program. There are others, but that's the one I'm most familiar with. They said, oh, never heard of it. I said, oh, no one has it here. And no one's ever asked for that at Gavi. They've never heard of it. That's not true now, by the way, at all. That was when there was no M&E function, right? But they said, no problem, we can order it for you. So give us the information about what edition you want and all that stuff. I said, oh, that's pretty cool. Okay, so I gave them the latest edition to go order, and they did, and I never used it. I never opened it a single time because it wasn't part of my daily role anymore. And to be honest, right now, if you were to put Stata in front of me and you were to tell me, or R or anything else, and ask me to generate some basic code to do something, I used to be able to do that blindfolded, probably. Now I cannot at all. I would need to relearn it, basically. So I don't know if that's sobering or interesting or crazy or what. But maybe just to emphasize that doesn't mean that I didn't engage in technical issues, right? Because I still felt I was quite deeply involved in a lot of, hey, my guy, how you doing? Good to see you. I still felt that I was involved in a lot of analytical related activity, including the initial conceptualization and the ins and outs of various methods, data interpretation and use, just not running it myself. And I do think as I've gone from job to job, like at the Global Fund, I would say I was even a step farther from that relative to Gavi. At the GFF, it's a mix. I mean, I do still work with data a lot and support analyses, but just not myself running it. I think maybe to answer the question more concretely, so what I actually spend my day on then, there are a lot of meetings, to be sure. It's like definitely, a major outbreak of meetings everywhere that consumes a lot of time and energy, some of which are interesting, some of which are really boring. I do also spend a decent amount of time writing. I spend a decent amount of time creating PowerPoint slides, supporting others to create, to write, feeding back on other people documents and PowerPoint slides that other people are writing or preparing, giving a lot of presentations, a lot of chairing of meetings, defining of new strategies, forming partnerships. Mike and I, we've been working together in context of the Countdown to 2030 partnership. Within the GFF, we've really, doubled down on that being a very important partnership for us, JHU being one of the core technical partners within that work. We love the model. We love the role of Hopkins and the other academic institutions and technical partners. And then we love that in the partner countries, there's a local university or other technical institution, University of Zambia, Makerere University, for example, leading the work in country together with the Ministry of Health. It's connected to the GFF engagement model. We've been supporting a lot of analytical work through that. Mike much more directly than myself, but we've been attending a lot of the same meetings together. We run these multi-country workshops where we brought in June, did we have 22 countries together from throughout Africa to support them to, it was both the local university plus the Ministry of Health to help strengthen a process that they lead to regularly analyze coverage and equity along the RMSHN continuum, as opposed to relying on just a more top-down global estimation process, which is more the model in HIV or immunization. Great. Yeah.
Practice, but also maintaining my analytical skills and figuring out how to work with data or find the time to do that on a daily basis sounds daunting. And maybe not realistic, but it also, I don't want to close doors. So
Yeah.
if you have some reflections on that, I mean, you touched on it a couple times. But.
Sure. Well, I personally, I think it's wise to keep one's options open, right? I mean, I think life is so unpredictable in general. And I think like mapping out, trying to over plan your career, right? As if you could control it in that way or predict what doors will open for you when. I think it's just not realistic. So I think to me, it's more adaptive than that, and just making sure one is equipped, right? The right skills, the right knowledge, the right energy and mindset to take advantage of different opportunities, to me probably is the most important. I think the longer, I mean, just generally speaking, I think the longer one can keep one's analytical skills current, while also branching out in new areas, to me that resonates. I mean, I do think one can reach a crunch point within that, right? Like I know I began to reach out at Gavi, and then I reached it even more so with the Global Fund. Like I couldn't do what the institution was asking me to do in the job that I had at the Global Fund and still do all of that. Like I was already waking up at 4 a.m, and stuff like that. Like it just was not going to fly. But as long as I could, like in Afghanistan, I felt I was able to do that. I felt not that I was ever the greatest statistician in the world or the greater coder in the world. I wasn't, right? That was never, I don't think that was ever my greatest strength, for example, but I took it on as an important thing. I found interest and satisfaction in it, probably more than I originally thought. When I went to that first biostats class, I thought, I don't know, I think I'm more interested in the qualitative stuff than the quantitative stuff, or give me the conceptual stuff. Don't necessarily, I'm not necessarily, I wasn't sure I was going to be interested in going deep into the quantitative sciences, let's say. But I really found, I remember someone saying to me early on, actually, my first year at Hopkins, Stata is your friend, right? You can do, if you figure out how to use Stata, it will solve problems for you. You will be able to address issues and do things that you're not otherwise going to be able to do. And I thought, ooh, yeah, that sounds good. Like, why am I going to approach this with a bad attitude and be like, I think I'll just go do the qualitative stuff instead, right? Because it's not like it's that may have been my path of least resistance, but I think by just overcoming a whatever small hurdle of going into the quantitative stuff more, I do think I think it made me a more rounded person and professional. And I think it opened doors for me. And I as long as I could keep that going, that made sense for me. But when I reach a point where where the trade-offs didn't allow that, then at least I could make an informed decision at that point.
I would love to follow up. I would love to follow up with that. You mentioned that you didn't feel like at some point that you could come back to academia credibly. I'm sure it wasn't the case. But I wonder about this, like your feeling about coming in and out of practice academia. Can you go back and forth if you go to practice? Do you feel like you can come back to academia? If you start in academia, do you think you can transition to, I mean, I think there are some views in the room probably, but I would love to hear your thoughts.
So I think the short answer is yes. I think one can definitely go back and forth. And I think it depends on what the role is, right? Like I would never, even when I graduated, even when I was most familiar with Stata, I would never have pursued a faculty job in the Department of Biostatistics, right? Because I just knew people who went through that program would be more rigorous in that area than I was. And actually, maybe here's another anecdote is, yeah, I do remember even in my thesis defense, I don't know, is Karen Bandine Roche here in still in the Department of Biostatistics? Yeah, she's awesome. Okay, yeah, so she was on my thesis defense committee. I remember this issue coming up in my thesis defense because my defense covered both issues of practice and methods. And I remember being, I don't think I was sheepish. I don't think I was embarrassed or apologetic, but I think I was honest and open about the fact that I felt the work that I'd been doing in the background, of which the written dissertation was one product. This is by no means the only output of that work. I might even say it wasn't even the main output of that work, but it was like one important output of that work. I felt that the body, the energy and the body work that represented was both practice and methods. And I wanted to be honest about that. Because there was part of me that felt was like, okay, this is Hopkins. This is the best of the best. And when you do a dissertation, you need to be like super rigorous on the methods, and maybe some of that practice stuff doesn't belong there. I think it does belong there. And I remember Karen Bandine Roche even specifically making that case. And she put it in a way that still sticks with me. But that is core public health science. And that is part of what Hopkins is trying to train its people to do. That not only that if you only know the methods, but you don't know how to apply it, you don't know how to put that into practice, you're probably not a balanced professional. I thought, wow, Karen Bandine Roche is saying that. Like, she's an awesome biostatistician. It's like, yeah, it must be true. Yeah, she does not lie, I'm sure. So yeah, so that's just one reflection there.
Back to your Afghanistan experience, I'm wondering. You found that you have a lot of time to build relationships. I think that is so rare in today's public health system, where you just come in hot, do your work, and then go. Especially also in the monitoring and evaluation field, where at least I feel I'm always brought in to plug holes, do the analysis, tell you how your program did, and then leave. And that also relates to the decolonizing piece of what's our role within this public health world to make the programs better. Is this kind of parachuting in quickly the way to do? So I'm curious, where are the work environments where we can find or advocate for more time, more resources for monitoring and evaluation to less function as like a, thing that you call in at the 11th hour to figure out how your program did?
Yeah, no, thanks for that. Yeah, I don't think there's no magic solution to that I'm aware of. I think it does take some advocacy. I mean, I think one needs to make the case that whether it's monitoring evaluation or really a variety of other terms that we could use that relate to how data are analyzed and used to inform decision making, for accountability, for course correction, program improvement, to enable learning. I think one needs to continuously press the case that to do that well, it really has to be built in from the very beginning. I think so much of the practice in our field, which I think is coming probably not from us in the room here, but from the the donors of programs, high-level decision makers who have a lot to worry about, right? Not just the data and the results and the M&E and so forth. I think it's, to me, there is need to just continuously argue and make the case that building that in from the beginning is a wise investment. Yes, it's going to take resources. Yes, it's going to take time, but that ultimately that will serve purpose much better, because what you'll have really is more like an intelligence system, right? Not just the bean counting thing, or not just a report that you're going to get at the end, but insights that are actionable, that are going to be generated along the way, which can be used to improve the program, to improve outcomes, enable learning, and all of that. I do think a lot of people seem to resonate with that argument, including a lot of funders. So I don't think it's not an impossible task to make the case. And I think a lot of funders have shifted their practices more toward that perspective, but I can envision that that issue is not going to go away, that does need to be continuously stressed. Maybe just if I can add a kind of part B to that, a related reflection is I think it's also important for us as practitioners to think about feedback loops and timeframes, because it's actually kind of goes when I was talking about the faster work program that Angelica has been working on, this rapid cycle analytics and data use. Obviously, the big concept there is moving away from a very lagged approach, right, where you get a set of results or findings at the end of a process, to instead build in the feedback loops and more of a continuous prospective nature. I think it's important for us as practitioners not only to make the case for that upfront investment, as I was saying a moment ago, but also to invest in making sure those feedback loops really work along the way, because so much practice in our field is, I think, inadequately responsive, inadequately attentive to real needs that decision makers have along the way, right? If we're focused on that output at the end and missing those opportunities to share data, analytical outputs, and information that can be used in the meanwhile, then that's on us. Then I think we're contributing to perpetuating a problem.
I'm wondering if you ever work directly with policymakers, so in order to get at the root of the problem earlier. And I also was wondering, unrelated question, what your personal life looks like with this role. Do you have to work in a specific station now, or can you work remotely? Do you feel like you're compensated well to support your family? I'm just wondering about that as well.
Yeah, thanks so much. Maybe I'll start with the second one. So I'm based in DC, and we were just called back after Labor Day to work 4 days a week in the office. I know, which is such a drag. I way prefer a more flexible approach and working from home. I find it more time efficient. I find it works better for work-life balance. Actually find also I'm more productive. Actually was working more hours and more productively at home than in the office. It's the commute, it's a lot of other things which get in the way, but the being inside the World Bank, like one downside of being in such a big institution like that is when the management line fixes that and says, you got to be in 4 days a week, enough of this working from home stuff. If you want to continue to be employed there, you kind of need to adapt to the program. So I'm going in 4 days a week now. I out of DC with some travel, but I do think travel is lower than it was pre-COVID. I mean, I was not in this particular job pre-COVID, but I do think within the GFF and the bank, I know this to be true, but I think it is true in many places, that the experience during COVID of having work very abruptly shift to virtual and kind of remote modalities, I think enabled us to get better at doing that, and also to see what is possible doing that. So I think there are things now that we're able to support and achieve remotely, like through virtual interactions, which previously we would have probably done more of the fly in, fly out thing. So I think that's a good one. In terms of the other things, I mean, quite honestly, when it comes to things like compensation and benefits, I'm better compensated than I ever imagined. And I think when I decided to go into this field, I actually had a notion that probably the pay and compensation is probably pretty low, but I didn't care very much. I was interested, and I think what I found is that I think the compensation in our fields, obviously it varies so much by role, but I think for the most part, there are a lot of good jobs in our field at a very decent compensation level. So I don't think one needs to make a vow of poverty or have diminished compensation to work in this field. I think at many different organizations and levels, it's quite possible to do both. terms of the policymaker work, yeah, I think I've been lucky to have quite a lot of opportunity to work directly with policymakers. I mean, certainly in Afghanistan, one small anecdote there is one of the research studies that we nested in Afghanistan in the broader kind of M&E framework we were supporting was on health financing. There were various health financing strategies that the Ministry of Public Health was weighing. They put in place, I mean, yes, it belonged to the ministry, but we at Hopkins, we were technically supporting a health financing pilot evaluation, which was directly used, to inform their health financing policy. And they made a decision directly on the basis of this study that influenced their national health financing policy. And they wrote a letter which they sent to every provincial health directorate and every NGO in the country, and they cited the work that we were doing in this. And I looked at that letter and I thought, that's kind of nice. It's like, it was a direct statement that the Ministry of Public Health made this policy decision based on evidence that was supported by Hopkins. And I had the chance that the specific meeting in the minister's office where that decision was taken, I was invited. I was the only non-Afghan and non-MO, like official, I was unofficial MOPH because we were embedded within the ministry, but it was basically the top leadership within the ministry and myself. And it was very interesting because throughout the entire conversation, it was an exchange of opinions. And the table was split. The minister was chairing the discussion. There was basically half the participants in the room thought it was an absolutely terrible idea to waive user fees and make services free. It would lead to a wide range of problems. The other half of the room was equally convinced it was a good thing. I sat there and listened because I didn't feel it was my role to actually participate. The minister turned to me at one stage and said, you've been supporting this work on the health financing pilots. What does the evidence show? And so I summarized what the evidence shows. The minister summarized on the basis of that study, and he said, that's our policy decision, right? We've heard a lot of opinions around the table. We're making this policy decision around this, and that literally led to all basic preventive, promotive, and even several forms of curative care to be free throughout the entire country. So I think that was a nice opportunity. I think it was lucky to have a chance to be part of that, both Hopkins as an institution and myself. In GFF also, I think, one advantage of being hosted by the World Bank is we do have a lot of access to policymakers at country level, both Ministry of Health and Ministry of Finance. So there's a lot of direct engagement, a lot of direct support for policy processes, and a lot of the data and analytic work we do within the function that I lead is supportive of informing policy decisions that those ministers and the processes they lead follow. So I think that's a one strength of the GFF model.
Okay, I have another one. If students want to get a job like some of these jobs you've gotten, but GFF, Global Fund, Gavi kind of jobs, what should they make sure they take or they attend to here while they're in school?
Everything.
Everything.
Yeah. I mean, in the sense of, not in the sense of everything will be directly relevant for every job application you do, but more in the sense of soak it all up, right? I mean, it's, if you're faculty here, you can work for decades. You can spend your whole career here. You don't even have to retire in your 60s. You can work in your 80s if you want, right?
Unless you want.
Yeah, unless you want. Imagine that. But if you're a student here, you're going to spend you're going to spend somewhere between 1 and maybe 7, 8 years or something like that, right? Soak it all in. Learn as much as you can about methods. Learn about, acquire knowledge, acquire competencies, get to know a lot of people. I mean, let's face it. Also, it takes a lot of luck to have the right doors open for you at the right time, and networks can be really, really important. There's a sinister, unjust, unhelpful side of that, right? When there's too much bias toward who you know, or toward people who look like you, or come from the same place you do or something like that, then obviously that's a distortion, right? That works against a meritocratic approach. But there's a side of that networking, which I think is also healthy, right? Which goes back to, relationships and trust and information sharing and knowledge. So I do think, the people that you get to know, your professors, your classmates, people you interact with, will some of those same people may be in position to offer you a job one day, or you may hatch an idea together, which you can collaborate on and create something out of. All of that, I think, matters a lot.
Yeah, I was in a Global Fund meeting one time, and somebody got up to speak, and I was like, I recognize that guy. And he was I even forget his name, but he was like the most senior person in the room. And afterwards he said, remember I did my practicum with you? And I was like, oh yeah, it does pay to have good relationships all the way through.
Yeah.
Other questions? Wait.
Mine's a, can you hear me?
Yeah.
Mine's a really simple question. I'm just wondering, are you planning to stay in this role moving forward? Or are you planning to do something else that you think might be great to add to your career?
Yeah, good question. I don't know. I'm still quite focused on this role. I still enjoy it a lot, and I think it's creative and dynamic enough that there are still new experiences to be had. I have felt, I don't know if anyone here has taken the qualitative research courses here, but the concept of saturation is important in a lot of qualitative research, right? To me, it's been a relevant concept with jobs as well. One anecdote I skipped when I was talking about, I think when someone asked about my decision to leave Afghanistan and move on, I think I meant the answer that I gave, but of course there are other anecdotes that speak to that as well. And one different kind of anecdote, it's nothing to do with security or anything like that, is I do remember being in a meeting one day in the Ministry of Health, and I knew exactly what everyone around the table was going to say. It's like I could predict it before they even said it. It's like a technical advisory group meeting with 8 people or whatever. And I was like, I have heard that person say that 17 times. I've heard that person say it 23 times. It's getting predictable. And there's this certain level of saturation. I've experienced that at Gavi also, where I was like, okay, it's been a great run. Like I really enjoyed it, but now like I'm doing the same things. And I feel I reach a point where I'm doing the same things again and again and not having as many new experiences or learning new things. To me, that's a good cue that it's time to move on. I haven't reached that point yet at GFF, so I'll stick around for a while. But after that, who knows?
Okay, here we go.
Thank you. Is there anything like throughout your career that you wished you would have done differently?
Yeah. Yep. More country experience would be better, for sure. And I think like when I was my little anecdote about leaving Afghanistan and going to Gavi and saying, I'm only staying 3 years. And then back to country level. I never did that. Right. So I've been in global roles since then. That was not my plan at the time. That was not my intent. And that is something that I've missed for sure. But I'm not giving up on it. In fact, I mean, I didn't speak to this because I was trying to be concise in responding to your question, but who knows? Maybe when I reach that saturation point within the GFF, maybe it will be a good time to move to the country level, especially within Africa. My most in-depth experiences, as I mentioned earlier, were in Afghanistan and China. And I've been to Africa n number of times, but the typical trip for me has been a relatively short one. Honestly, a little bit more of a fly in, fly out. I don't, the kind of depth and relationship building that I described, for example, in Afghanistan and China before that, I don't have any experience in Africa with that level of depth or meaning, and I would like that. I would personally find that enjoyable. I also think that would make me a more rounded person and professional. So yeah, I think that might be a good one next. But let's see.
So on the other side, how do you balance a good relationship? So for instance, partners, right? We have long lifetime partners. How do you balance that with, respecting them and their time and your family's time?
Yeah, that's a tough one, really. It's I don't know if you've got any answers on that. Let me know. There are a lot of trade-offs associated with that, for sure. And I think with kind of within my own relationship with my spouse and my family, I think we've tried to stay in good communication on that. It is something we discuss pretty regularly. I've certainly around every one of our moves, every job change, every physical move, it's something we've discussed very extensively. I do think as things have played out in our particular family, we've been moving more for my job than Kavitha is the name of my wife, rather than for Kavitha's job. But it doesn't have to be that way. It's not ever because my job is more important than her job or because my needs are above hers. That's totally to the contrary. But it's just the way it's played out. And I've expressed to Kavitha many times that if she wants to take a job in Nairobi or Cape Town or Dakar or who knows what, I'm game. We can move. Let's do it. And in fact, one advantage of being within the GFF and the World Bank is I actually could potentially rotate to another country and even continue to work for them, which makes every transition easier, right? Because if you're removing one variable. If you can move if you can stick within one institution and move, that's really, practically speaking, that's often a really good way to do it. Do we need to wrap up here?
No, I'm sorry. There was a problem with the ordering of the food. So we promised you food and we will not have food. I'm sorry. But that means we have a couple more minutes to chat. And I didn't mean to cut you off. But I did want to ask if you could, I know that Emily and some others might need to go. I wanted to ask how you look for jobs at GFF, World Bank, and like monitoring evaluation kind of data related jobs at GFF, and if you have any insights about World Bank more generally in an area that I think is interesting, like M&E, not like financing stuff, and then Gavi, and then the Global Fund. Yeah, go ahead.
Yeah. So, I think all of those organizations do post jobs on their websites for sure. I think it's useful to do a little bit of landscaping, kind of scan the landscape before you really need a job to understand what's out there. Also, I don't know if your mind works this way as well or not, but for me, I know sometimes, like when I've been in the mode of beginning to think about a new job, sometimes if I see a role, like my mind can go for it a little bit, and I can even project to myself, ooh, that looks interesting. What would that be like? It either catches my interest or it doesn't, kind of thing. And so I think looking, giving yourself time to see across multiple agencies, if you have the flexibility to move even to different places, multiple geographies, multiple different jobs, the more you can see what's coming through, I do feel that can help you calibrate, like understand what's out there and then calibrate your own search engine or whatever, to use a weird term for that, to what might really suit you. I think I've done that sometimes in the past. I think that's been quite useful. I also think, like I was saying before, I think networks are really, really important. And so don't hesitate to talk to people, put the word out to people when you're interested in something. Also find out if you know someone within an organization, you're interested in that organization, be proactive, and there's absolutely nothing wrong with reaching out to someone and saying, hey, I'd be interested in thinking about joining, your organization. Can you tell me, what is it like? Are there opportunities coming down the pipeline that you think may be a good fit? Can you let me know if you see anything? I think that's a very suitable thing to do. And I think my experience is most people have been very willing to engage like that. When it comes to the World Bank and GFF specifically, we're very constrained in terms of staff roles. In fact, our headcount is limited. And even when jobs free up, there's an internal rotational system. So the majority of jobs, like the full staff position, the majority of jobs are filled that way rather than through an open competition, which is a bummer because it really limits the ability to join from the outside. But it doesn't mean it's impossible. From time to time, jobs do open up. And a great way to enter at the GFF and the bank is as a consultant. There are two main consulting modalities, what we call the STC, or short-term consultant, or the ETC, the extended term consultant. Both have their advantages and disadvantages. The sort of benefits and parameters around each are a little bit different, but both enable you to work within the system. They enable you to do interesting work and to get to know a lot of people, right? And once you're on the inside, you get to know other people, they get to know you. That creates a lot of opportunities. So, for example, around the faster work program, which I mentioned earlier, and which Angelica is working on, that's been a great pipeline. I mentioned we have a lot of Hopkins alums working on that. We've had several people move from short-term consultant to extended-term consultant. I would say not yet to staff roles, but that's just because those positions come less frequently, but that will happen as well. So feel free to contact me or contact other people and I'll be happy to share information with you about when opportunities come available.
And to reduce the risk that you get 25 emails after this, is there anywhere that they're posted when long-term and short-term, extended term and short-term consultancies are publicized?
Yeah, I'll be happy to share a link. Yeah, it's probably easily searchable as well, just on Google. Like if you just say World Bank extended term consultants, I think that will come up. But I'll also send the link just in case it doesn't come up that easily.
There's a newsletter that Brandon Howard sends every Friday. Oh, well, yeah. Okay. Oh, well, that's how I found actually the position I'm working now on. So that worked out. And yeah.
So International Health has a weekly newsletter that goes out via email. And she said that her opportunity came through that. So I was just trying to figure out who posted that opportunity to see how we could get, sorry? Yeah, okay. We'll try to, yep, Sabina. I think some of your PhD directors, some of your departments send out stuff like that, I hope. Okay.
Is there anything that you miss about working in the academia setting that while you are working in the non-academia setting?
Totally, for sure. I would say the intellectual rigor and excellence. I think, what, to put it a little bit bluntly, I think in a lot, like the more managerial, the more I'm thinking back to earlier part of our conversation about their technical roles, their leadership and managerial roles, and their mixed roles, right? I mean, the more, if we plot them out on a continuum, right, the more you're in a pure technical role, I do think the more rigorous you're going to be with your methods, right, and your approaches. And I think people working in those roles also tend to be much more comprehensive and complete, right? Like really seeing an analysis through properly. For example, the more you shift toward the management and leadership side of the continuum, the more you get an 80-20 kind of thing, right? Where people, there's a little bit more of a let's not make the perfect be the enemy of the good kind of perspective, where a certain threshold of confidence or certainty may be taken as adequate, right? Whereas someone closer to the methods might say, well, wait a minute, like, sure, you see one output that you liked and that was convenient to inform a decision, but that might not mean what you think it means. And that's coming from a descriptive analysis, and we're doing a deeper causal analysis. That manager may be gone, right? They may be on to 3 decisions down the road already before the conversation's even finished. So I like I like both, but I do miss the rigor and excellence that comes with the technical work. Also, I do like the independence, the flexibility, and the creativity. One of the early on in when I was throughout my experience at Hopkins, including when I was in Afghanistan, I truly felt independent in the sense that I felt we were following I was going to use the word moral compass, but it's like a compass of truth. We were interested in the truth. I didn't have a side. I didn't have a corporate interest to represent. I didn't have to worry about a favorable press release or a resource mobilization event. When I shifted to the Gavi and Global Fund type of thing, and even now in the GFF, you have an external relations, is ring a bell, Melissa? You have an external relations function. You have a comms function. They have constant need. From a distance, you might think they're loaded. My God, the Global Fund has so much resource, right? They don't need to worry about money. They're sitting on all the money in the world. No, they worry about money every single day, right? There's a constant churn, and so much of the energy in the institution is worried about protecting the reputation and raising money, and it can distort technical work sometimes. My point is not to call out the Global Fund. I just specifically, it's just an example, but I think organizational, you can look at it from an organizational sociology perspective, I think, right? It's predictable that organizations will try to protect themselves and advance their interests, right? And that will mean protecting reputation, a bias toward a positive result, desire to avoid any negative result or any evidence that challenges the positive results being put forward. That's a big issue. I remember some reality checks early in my time at Gavi where I felt I've lost some of that independence, and there was more of an expectation that part of my role was that I would support the comms and external relations function with good news stories that would support the reputation of the resource mobilization. And none of it was rigged, right? We were always true to the data, but you have to manage that tension on a daily basis. So I miss that for sure. Like there is a freedom and a satisfaction when you work for truth. I mean, that's great.
Independence of a.
Oh yeah.
We had the same. We had the same contract issue with.
Oh, interesting. Yeah.
They us to only publish things that they, which has that same problem, right? You're not independent. And publish good news. But so I'm going to publish bad news, and that our admin did not process the food order. We can stand around and hold water bottles in the gallery if we'd like to, or until 5:30. But I apologize for that. We just learned that it's not what we expected. We'll order twice as much next time. Better come hungry. And I just want to take a second it was really fun to have this back and forth and to learn about what you've done and your perspectives. And I want to. You can hang out with our water bottles.
Hi. Yeah, we met previously. I'm working on lists. When I was at Gavi, you were listing. Are you still working on them? Yeah, it's really good to see you. I thought that was you, but I was. Yeah, I appreciate that. Yeah, now you mentioned that's wonderful. Yeah, I'm sure. You can reach out. Very nice to see you.
Yes.
Yeah.
I'm proud.
Nice to meet you. Yeah.
It's great.
In my mind, it's like part of what we're seeing.
There. Yeah. Feels like no job out of DC didn't have great. Yeah. So a lot. But I understand. I got it.
Good day. Hey, Maya, so nice to see you. Maya, great to see you. Okay. Yeah. All right. Okay, see you next time. Yes. Yeah. I can't say. Yeah. That's it. Oh, yeah. And that's not the base stuff yet. Planning and then the speaker. Okay. Hi, my name is Sherry. Okay, nice to meet you.
Hit everything, aren't we?
Oh, share? Oh
So-
no, where's the?
Not her.
Oh no.